shift gears a little bit and talk about healthcare specifically. So, sorry. Is that better? Yeah. Okay. So I'm really excited to speak with you guys today about a topic I'm really passionate about. My goal today is to help share lessons learned and a thoughtful framework that can be used to create transformation through Techquity. Let's see here. Ta-da. There we go. Okay, cool. Over the last several years, due to COVID, the healthcare industry has witnessed a rapid growth and adoption in technology. The convergence of access and digital has resulted in areas of inequity, such as digital literacy being considered a super determinant of health. It impacts families, patients, caregivers, and care teams. The goal of Techquity is to innovate and create products that are inclusive, equitable, and the assurance that the use of technology doesn't further widen the already existing gaps of inequities in our systems today. To begin, I'd like to share a personal story to help give context as to why I'm so passionate about the topic. That's baby Christina, by the way. I grew up in a bilingual household with an immigrant parent from Guatemala. At times, my mom was dependent on my siblings or myself to aid in navigating complex conversations. That's not an uncommon experience to act as a translator in everyday circumstances. In the US is a very diverse place. In 2019 alone, there were over 2.4 million immigrants arrivals into the country. Like many who come from diverse backgrounds and have unique stories, this leads to a desire to have an approach to care that meets those needs. In 2022, 13.9% of our population in the US was foreign-born. As you can see here, the primary language is also varied within the US. Nearly 68 million people spoke a language other than English at home. This is incredibly important to us because we need to have the ability to communicate bidirectionally for access and understanding in many industries, but it's really critical in healthcare. The heightened need to understand prescriptions, instructions, education, general appointments, etc. Many organizations I've worked for over the past 20 years have searched to develop inclusive and customizable products to serve and create improved experiences for patients and care teams. The evolution of using more technology-based tools to meet this need has accelerated dramatically due to providers leaving the workforce, finite clinical support resources, and cost containment. Oops. Hospitals have witnessed an increase with IT expense and a continued reduction in operating budget. Digital health or health tech companies, meanwhile, have raised $8.6 billion for the US for health funding, for digital health tech funding alone. So that's pretty significant. And there was a huge boost you could see in 2020, 2021 due to the pandemic and the realization that healthcare needs to come into the 21st century because we've been slogging along for a really long time, with a focus specifically shifting from on-demand care products to those that support disease management, non-clinical workflows, and complex illnesses. You may be familiar with this slide or the graphic depicting equality versus equity. It's a vital representation of how to view equity, especially when we seek to create more meaningful tools to support patients. By creating tools that are more equity-centric, this can lead to a reduction of missed appointments, better adherence to care, and more. I really love this quote from the Forbes article, The Techquity Imperative, How Technology Can Improve Health Equity, because it tells us that we have the power to impact the experience resulting from the technology that we implement. In a report by the Center for Connected Medicine earlier this year, it identified that patient access as being top of mind for the second year running. So what that tells me is access is still a difficult problem to solve and technology needs to be implemented thoughtfully. Now let's get into an example which illustrates how success can be achieved with experiments and a Techquity mindset. Okay. To most health systems in 2020, telehealth was an immediate solution for access due to the pandemic. At the time, I was working at a large pediatric hospital that cared for patients across 4 states with over 50 specialty and subspecialty services. It was easy enough to launch an immediate solution for telehealth and provide access. However, it was quickly realized that it wasn't enough. Inadvertently, we created limitations to access because technology was simply turned on. By April 2020, what had not been fully understood is the impacts of technology compounding already existing real inequities. So we led with the data. The team created a map that was a cross-reference of our demographic service area overlaid with social determinants of health for that same area, and the gaps were staggering. We found issues with connectivity, the ability to forward cell phone plans or devices to even conduct telehealth, the need to understand alternative languages spoken by our patients in our population we served, and the understanding just how to connect the digital literacy component. We spoke with our patient advisory groups and staff. This really helped us understand where to prioritize our efforts first. The result was a coordinated and tactical approach of a series of intentional pilots based on lean principles that allowed us to focus on areas where telehealth was creating disparities. But what does that look like? So one pilot, for example, is we reached out to a list of non-English speaking patients who had upcoming telehealth appointments. We partnered with a volunteer program that had native speakers to connect with each person on the list, thinking that that would be helpful to educate them on how to connect to telehealth prior to the appointment. At the end of an 8-week experiment, we found that patients actually didn't really care about the handheld approach. Most families and friends, most family members had friends that could help them connect to telehealth. They really just wanted clarity on appointments and other relevant, clinically relevant information in their preferred language. So this experiment helped remove our own beliefs and our biases on what we thought the priorities were for our patients. And so we went back to the patient and advisory group and started asking different questions. So some of our solutions were financial support. Many patients and families with fixed incomes couldn't afford minutes on their cell phone plans, or they didn't want to have telehealth in their homes because they didn't want people seeing into their homes. So specifically, we created a partnership, because I live in Seattle, with T-Mobile. We were very fortunate, and we determined a way to manage costs for services via grant-based funding for hotspots and devices to loan. We also created locations where people could go and do telehealth in a remote location, so they didn't have to do it out of their homes. We were able to also tap into existing federal funding programs that were designed to support patients and families with general needs, all reduce the overall total family spending. We really wanted to ensure that people had the time, the resources, and the ability financially to connect to care. We created digital literacy programs, and we connected with patients prior to discharge to make sure that they were able to access and understand how to use technology before leaving the hospital. And we focused on shifting our gears from only a couple of serving a couple demographic groups of patients from a language perspective to really widening to cover 96% of our total population we served from a language perspective in our communications to our patients. Our outcome was more people of varying backgrounds were able to receive a higher number of completed visits, improved clinical outcome measures, and a greater reach to those in need. This really shifted the organization's perspective on how we viewed how to approach bringing digital transformation and technology into our organization, because now we had to consider all the inequities that we were potentially creating by bringing technology to the patients that we served. One might say this was back in 2020 and it's no longer an issue, but healthcare systems are a bit slow moving, as many of us know, and everybody is in a different space in their journey, and so it's still a valuable lesson learned today. Another quick example I have is around remote patient monitoring. Remote patient monitoring is a really popular topic in telehealth, in healthcare systems today. And so as you can see here, asynchronous, which is one direction of telehealth, it's considered store and forward, where you take an image or data or information and then you can pull all the content together, put it in a database, and for the provider or the practice to kind of digest and process later. This technology is really beneficial with chronic or long-term care management. And it allows us to observe the patient from a remote location, typically at the patient's home. For my current company, Pediatrix, we have our maternal fetal medicine providers partnered with a device company called Haramed to provide a home Doppler to be able to listen to baby's heartbeat with a comprehensive app to help monitor high-risk pregnancies. So the big value proposition of this particular pilot was to reduce the number of in-person and total visits for the MFM provider. So as you can see on this graphic here, in the gray is the traditional model, where you can see a high frequency of all in-person visits for that mother during the duration of her pregnancy. What we were able to do with the RPM tool is we were actually able to convert to more telehealth-based appointments. And we were actually able to reduce the total overall number of appointments with this particular pilot. And that's especially appealing for people that have transportation, childcare, work obligations, income challenges, or other social determinants of health that are impacting one's ability to access healthcare, frankly, at that frequency. So some of the challenges we faced in this particular pilot were connectivity to the device and using Bluetooth in people's homes, cost of the device. Is this something that would be covered by insurance or not? That's a real challenge that we face with a lot of RPM tools. Digital literacy, which is always resulting in a mix of adherence. So we can have all of these great technologies, but if people don't use it or understand how to use it, then it's not going to be of value to our clinical teams or our patients that we serve. Another big challenge that we see or that we have with RPM or the remote patient monitoring is the data. So all of a sudden now we have this excess of data repository and we're trying to figure out how to process it efficiently. So I definitely think a lot of the AI conversation is very appropriate because I do think that AI paired with RPM is going to be really valuable for us in the future because we don't have a really great way of digesting the data that we're now getting from these tools. And so what it ends up creating is actually more work for our clinical teams to utilize technology than it actually supplementing or supporting our services that are already really finite. So what we did to find success in this particular pilot was simplify the requirements. We got buy-in from our clinical teams on the development of the technology, and we were able to provide free devices for this particular pilot. So for this particular pilot, we were serving patients in the city of Atlanta, and Atlanta is considered a maternity desert, which means there's not enough physicians to support the ratio of pregnant women in the community. And so this was able to extend our reach and serve more patients because of utilization of the remote monitoring tool. So as I mentioned in my quote earlier from the Forbes article, any technology can be a benefit or a burden. It's all about how it's designed and thoughtfully implemented. The need for equity in the development of technology is more important than ever. Using lessons learned and principles hopefully will help pave the way for future transformation through Techquity. So some of the things that we want to make sure that we consider is who does this serve and how. Understanding the populations or the systems that the product is trying to serve. Simplify the process. I cannot express that enough. Making sure that we're leveraging human-centered design approach about learning what the priority is to the care teams and the families. Sometimes we as leaders make assumptions on what the area is to focus on, and adoption is key. If the people don't, they will not adopt what they don't prioritize, so we need to be really mindful that we're getting the right information and the right prioritization. Buy-in, using the data to help tell the story, making sure we understand strategic priorities of an organization, focusing on key objectives that can have iterative improvements, starting simple and being agile. Agile is a very new mindset, I would say, for working in healthcare. Healthcare is traditionally very waterfall, and so really leaning into working with operational partners and understanding the value of being agile, I think, is really important. Due diligence with an equity lens, ensuring that we're really looking at the root cause rather than the symptoms only, because in healthcare you pull one string and there are many. Simplifying logistics, maximizing device use when possible, making sure we can retire, that may require additional education or training or support. Experiment, so again with that agile mindset, making sure that we can create small iterative improvements, failing fast, really scoping down the efforts of exploration and taking lessons learned into the next iteration. Telehealth is just a turning point for us in healthcare and how we leverage technology, which impacts our patients and the products that the hospital creates. Technology in healthcare is here to stay, thank goodness. And the approach to product delivery needs to be reimagined. Techquity needs to be leveraged to achieve sustainable, meaningful, and scalable products. I hope you guys liked it. Thanks. There's my mom. My mom.